Have you ever wondered why some of the most courageous heroes in American medical history were nearly erased, despite risking their lives daily to save others? Follow if you've never heard this story. In the early 20th century, there was a disease doctors feared more than almost anything else: tuberculosis. They called it consumption because it slowly consumed the body from the inside out. Patients wasted away. Coughing fits filled the air. Blood-stained handkerchiefs. Entire families disappeared within months. There was no cure, no antibiotics, no ventilators, no modern protective equipment, just isolation, fresh air, bed rest, and hope. Hospitals were overwhelmed, cities panicked, and many white nurses refused to work in tuberculosis wards because the risk was simply too high. That's when a group of black women stepped forward. They would become known as the Black Angels. When no one else would go at Seaview Hospital on Staten Island, once the largest tuberculosis hospital in the world, hospital administrators faced a staffing crisis. TB wards were dangerous. Nurses caught the disease at alarming rates. Entire floors were considered contaminated. White nurses walked away. Black women, barred from most prestigious nursing positions by segregation, were offered an opportunity most people would run from: work in the TB wards, the most infectious patients, the highest risk. They said yes, not because they didn't understand the danger, but because they understood responsibility. One nurse later recalled, "We knew what tuberculosis did. We also knew what would happen if nobody cared for those patients." That decision changed American medical history. Segregated but essential. Even inside the hospital, segregation followed them. The Black Angels were assigned the sickest patients, the longest shifts, the least desirable wards. They often lived on site, separated from white staff. They were excluded from professional recognition, leadership roles, and advancement. Yet they became experts. TB nursing required intense skill, monitoring breathing, recognizing subtle changes, managing isolation protocols, administering treatments that were experimental at best, and maintaining emotional stability in rooms filled with death. They learned to hear danger in a cough, to see it in the eyes, to anticipate collapse before it happened. Doctors began to rely on them, quietly. One physician later admitted, "If a Black Angel told you a patient was turning, you listen." Why patients called them angels? The nickname didn't come from hospital administrators or newspapers. It came from patients. People who believed these women were angels because they showed up when no one else would. Families were often barred from visiting TB patients due to infection risk. Isolation was crushing. Many patients died alone. The Black Angels stayed. They sat at bedsides, held hands through coughing fits, sang softly to calm fear, explained procedures with patience instead of detachment. One former patient later described waking up in the middle of the night, panicked and struggling to breathe. A black nurse was sitting nearby. She didn't rush me. She didn't look scared. She just said, "Breathe with me," and I did. That presence saved lives. The cruel irony. Here's the part history rarely acknowledges. Many of the Black Angels contracted tuberculosis themselves. They were fully aware of the risk. Some nurses were young, newly trained, and already facing limited career options. Others were seasoned professionals who understood that TB exposure could mean years of illness or death. Some survived and returned to work. Some didn't. And yet they continued. Because Black women had long been locked out of safe, prestigious, and well-paid nursing roles. TB wards were one of the few doors open, and they walked through it with courage instead of resentment. This is the irony. America relied on Black women to save lives, while refusing to fully value theirs, changing the course of care. The Black Angels didn't just provide labor. They advanced care. Their experience led to improved patient monitoring practices. They helped standardize isolation protocols. They refined routines that reduced cross-infection. They brought humanity into a system driven by fear. And when antibiotics like streptomycin finally emerged in the 1940s, transforming tuberculosis from a death sentence into a treatable condition, TB death rates plummeted. Hospitals celebrated progress, medical journals praised innovation, and the Black Angels? They were barely mentioned. When the doors closed, as TB wards closed and hospitals integrated, the very women who had carried the most dangerous burden were quietly pushed aside. Some were reassigned, some left nursing entirely, some returned home with health complications that followed them for life. Their expertise was absorbed into the system, but their names disappeared from the story. This wasn't accidental. It followed a familiar pattern. Black labor used in crisis. Black brilliance relied upon. Black contributions minimized once danger passed. Why their story matters now. The Black Angels force us to rethink what heroism looks like. Not loud, not celebrated, not rewarded, but steady, unyielding, human. They remind us that Black history isn't only found in marches, speeches, and courtrooms. It's found in hospital corridors at 2 a.m., in whispered encouragement. In women who chose duty over safety when no one else would. They also challenge the myth that Black women were merely assistants in American medicine. They were foundational. They were innovators under pressure, leaders in crisis care, guardians of life during one of the deadliest public health battles in history. A legacy of strength today. Black women remain at the forefront of healthcare, often carrying disproportionate burdens, often under-recognized. The Black Angels are their ancestors. Their legacy lives on in every nurse who shows up despite risk, every caregiver who brings compassion into clinical spaces, every Black woman who heals in a system that has not always healed her. They turned segregation into skill, exclusion into expertise, fear into healing, and that deserves to be remembered. Say their name with reverence, the Black Angels. Subscribe here to uncover more hidden Black stories. Comment if you'd like to hear more about the Black Angels or other untold medical heroes. We don't glorify injustice. We reveal truth, so history can't repeat itself.